Hi, we are here to do our open enrollment meetings, doing them a little differently this year, so I don't get to see your bright shining face in person, but we're going to go through the information quickly in the video. There's also a PowerPoint presentation that you can watch and get your information from, and then we'll have some opportunities for you to ask some questions. So a little different format this year, but we're going to get through it. So this video is available on the desktop, and you can watch it with the PowerPoint presentation, which is also available on the desktop. It was emailed out to the houses and a hard copy was sent out. So you should have access to that presentation in some place. You might have to ask your supervisor. All right, open enrollment. What is it? This is your one time per year to make changes in your insurance elections. If you'd like to add, drop, or change any coverages, now's your chance. If you pass on this opportunity, you're going to have to wait another year to make a change. These changes are effective June 1st. That's when our new plan years begin for all of our insurance coverages. Failure to make changes now will leave your benefits as they are, and then you'll need to wait until next June to make those changes. Okay? All right, what if you're happy now? That's great. Only one form is required. Everybody watching this video, every full-time staff has to turn in one form, and that is the cafeteria election form. And Shannon's going to show you that form right here. This is the form everybody has to turn back to me, Kristen Klein, by May 6th, 2020. And if you participate in the health savings account, you need to fill out the bottom portion of it. So top for sure, bottom for some of you. How do I know what benefits I have? Am I in the cafeteria plan? These are questions we often get. How do you tell that? You can go to your pay stub. So log into the time clock, click on your pay, and look at your stub, and you will see codes on your insurance. It'll say benefits and deductions. If you look at the code, for example, if you have single health insurance, you will see HCS or HNS. It means health cafeteria single or health non-cafeteria single. So if you have the C in the code, it means you're in the cafeteria plan. If you have the N in the code, it means you are not in the cafeteria plan. And that is the same for dental and vision. You will see those. There is a pay stub deciphering key that is also located at every house in the office. It's also on the F drive. So you can see that code. There will be one at the end of the PowerPoint as well that you can review to see what the codes mean. Okay, so to check your pay stub, you will know yes or no if you're in the cafeteria plan. If you can't tell from there, if you call Kristen or Shannon, we will be able to tell you. So give us a call and we can tell you too, but check first. Okay, so that is the information. One form for sure has to come in by May 6th. No options. First, we're going to talk about our vision plan. We have VSP as the company. Rates are the same. There is no changes to vision rates this year. You do not receive a card for vision insurance. If you go to a provider, you give them your social security number, and they will be able to look up what benefits you have available to you. There's a high plan and the low plan. The rates are exactly the same. You will see it there in the PowerPoint, so I'm not going to read them to you, but there's no change to vision rates this year. And once you're in from June 1 to May 31st, and you get the benefits associated with those. You have the standard plan and the high plan. So the standard plan has a little less benefit. The high plan has a little more benefit. There are handouts that show you that when you're a new employee, or if you came to the open enrollment meetings the past couple of years, you would have had access to those. Basically, on the low plan, you can get up to $130 per frame every other year. On the high plan, you get $150 per frame every year. You can get an eye exam every year on both plans. The low plan does not include free no-line bifocals, anti-glare, that sort of thing. The high plan does include free no-line bifocals, anti-glare, anti-scratch. That's included for free. The premiums are a little higher for the high plan, of course, because you get more benefit there. No changes to the premium. Check the PowerPoint for those premiums if you would like to make a change. There is a form you need to fill out, and that is the vision form. Shannon's going to show that to you right now. That's the form you need. Okay. Dental is the next thing we're going to talk about. There are also 2 plans to choose from for dental. Your dependents can be covered up to age 26 on vision and dental. Premium changes. There are no premium changes. That's always a good thing. No changes to your premiums for dental, so you won't see a rate increase. The agency pays $14.78 toward single plans and $27 toward all other plans. You have choices of you and your spouse, you and your kids, or you and the entire family on the dental plan. The low plan allows for $1,000 of coverage for each person each year. It's a $50 deductible. The deductible is waived for preventative care, so that's your exam and cleaning. Covers preventative care class 1 at 100%. You can go in every 6 months and have your teeth cleaned and examined. You can get x-rays once a year. Those are covered at 100%. And it covers class 2 basic care at 80%. Insurance pays 80, you pay 20, and that is fillings, replacement fillings, space maintainers for kids under 19, and simple extractions. That is what's included in the low plan, up to $1,000 a year. If you bump up, the premiums are listed next in the PowerPoint, the low plan. Again, single is $0, spouse $1.52 a paycheck, kids $15.86 a paycheck, full family is $23.50 a paycheck. So you can see that in the packet. The high plan is another option you have for dental. Now the high plan requires a 12-month wait. So if you are on the high plan now and you drop down to the low plan, you're going to lose your 12-month waiting period, and you would have to start over if you come back to the high plan. So think carefully if you're going to drop to the lower plan, because you're going to lose some advantage there. If you're switching to the high plan for the first time, understand your class 3 major restorative items will not be covered for 12 months. You have to be on the plan for 12 months. On the low plan doesn't count toward your 12 months. 12 months on the high plan, and then they'll pick up those expenses. So $1,000 in the plan year for each covered person. $50 deductible, same as the low plan. This covers preventative care, same as the low plan. And the class 2 fillings and whatnot at 80%. What it adds on the high plan is your major restorative, your class 3 major restorative. Those are covered 50% by insurance, 50% by you, up to the $1,000 max on the year. And that's fixed and full dentures, complex extractions, complex oral surgery, a crown, bridge work, that sort of thing. That's what's covered under class 3. So if you have the high plan, you can get those services covered. Okay? Premiums are a little bit more. For single, it's $726, plus 1 is $1629, plus kids is $2673, and your full family would be $4186, and that's per pay period. So that's twice a month those premiums come out of your check. If you want to make a change to dental, you do need to fill out the form. Shannon's showing you that form right now, and that's the form we need back. Okay, moving on to health insurance. That's the big one. Okay, health insurance. You're going to see a slide that says annual cost of claims. Our claims are up. I'm just going to show you this one because you can see our claims are up a lot from last year. It's up. They're over $1 million, and this is just through March 31st, and that is we are a self-funded health plan. We pay for these claims out of our pocket up to the first $40,000 in claims that a person has, and if a person exceeds $40,000, and we've had a few people do that this year, then the insurance picks up the rest. The insurance that we pay for picks up the rest. So our rates are dependent on how well our plan does. So you can see our claims are up over $400,000 from this point last year. That's quite a big jump. We're still doing okay, but it's a large jump. We want that to start coming down the other direction. Even with that said, we are not changing premiums this year. We are able to keep our premiums the same for this one more year. So if you have single coverage, it's $51.75 a paycheck. If you have plus 1, yourself, a spouse, or one child is your option there, is $22.18.50 per paycheck. If you have your full family on, it's $253 a paycheck. And again, those are twice a month premiums. When we get paid 3 times, like we will in May here, that premium does not come out of the third paycheck. So it's just twice a month. No change to the health insurance premiums. If you would like to make a change, add, drop, or coverage, or whatever you need to do, if you have dependents that have their own job now, and they have their own health insurance. You can leave them on here until they're 26, or you can set them free and they can go on their employer's plan, and you can maybe save some cash that way. Think of your life situation, think of what you need to do, and make changes appropriately. The health insurance form Shannon's showing you right now, that is what we need filled out only if you need to make a change to insurance. Okay? All right, deductible for health insurance is going up $50. The IRS has changed the minimum deductible allowed in a high deductible health plan, which is going up to $1,400. It was $1,350. That again is not our rule, it's the IRS. We have no choice but to comply. And if you have plus one or family, it's going up to $2,800, which is up $100, and that again is per IRS rules. So premiums stay the same. Your deductible is going up a little bit. Your max out of pocket is staying the same. We didn't have to change that. So if you go in network, your maximum you're going to pay for single coverage is $6,250 if something big happens. And if you're in network and you have plus one or family, the max out of pocket, this includes deductible, would be $6,850. Now, most people aren't going to hit that in a year. If you have a big year, something major goes on, you fall down and break your leg, that sort of thing, you're going to get close to hitting these out of pockets. But if you just have a typical year, most people don't come close to the out of pockets. So that is what it is. Just a reminder, in the last payday, you noticed Wellmark is providing virtual visits for free until June 16th. This is if you have a provider that's in network, your doctor. A lot of them are doing virtual visits now. That is part of this, so check with them. If you are doing Doctor on Demand, which is an easy download, we've sent out information several times on Doctor on Demand. If you would like that information, you can sure contact Shannon or I, and we can send you out the flyer. But Doctor on Demand is a virtual visit platform. You just download the app. Very simple, easy to use, and those visits are free until June 16th. So take advantage of that opportunity. Doctor on Demand, you can access it through logging into My Wellmark on your computer and set up the Doctor on Demand account. Then you download the app in the mobile app store, either the App Store or Google Play, depending on what kind of phone you have. If you're not sure what Doctor on Demand is, go to YouTube. Search their YouTube channel, Doctor on Demand. They have a lot of information there. It's a good source. I've used it before. It works pretty slick. Okay, health insurance. If you want to make a change, you fill out a form. If you don't want to change anything with health insurance, no paper to return. All right, we are moving on to talk about health savings account. Because we have a high deductible health plan, you are allowed to have a health savings account. If you are currently contributing, you must elect a dollar amount going forward to the next year. And those dollar amounts you can contribute have also increased, $50 for single and $100 for family. Just like the deductible, so you can add more to your account. If you are 55 or over, you can add an extra $1,000 for that. That is on the cafeteria form on the bottom portion. If you are actively contributing to a health savings account, you need to fill in a dollar amount on the bottom of that cafeteria form. If you are not contributing to a health savings account, you don't need to make a change. If you fail to fill out that form, your contribution will go down to zero effective June 1. I can't continue with what you're doing. It will go to zero for the health savings account. So you gotta put a dollar amount in there. Okay. All right. If you are thinking, wow, health savings account, what is that? That lets you pay for eligible medical expenses that are not covered by insurance with pre-tax dollars. So you're talking about your out-of-pocket medical and dental expenses. So that deductible, we talked about your out-of-pocket expenses. The difference you'd have to pay at the dentist office and at the eye doctor, those are all things that you can use this money for. Hearing aids, if you need those. Health savings account can cover those accounts. Pre-tax dollars means you save money. You're not paying any taxes on that amount. You can open an account anytime you want. You can change the dollar amount you contribute anytime you want. You just got to talk to Shannon or I. The maximum contributions, like I said, the single went up $50, so you can contribute $3,550 between January 1, 2020 and December 31st, 2020. That is a calendar year contribution, not our plan year. It's a little different. Family can contribute up to $7,100, and again, if you're over 55, you can do an extra $1,000 depending on which one you're at. there. So if you would like to fill out to start a health savings account, you have to fill out the application. It's an American Bank and Trust is where we do our applications. You need to fill this out. If you put a dollar amount on your cafeteria form and you don't have an account right now, and then you do not give me the application, I cannot get the account started for you. So you need to fill out the application, give me a copy of your driver's license with it. I will send it over to American Bank and Trust. Whitney McDonald will give you a call to come in and sign the papers, or she'll probably mail them back and forth to you. She probably doesn't want to see you in person right now because their lobby is not open. But they will mail them through the mail to you, you return them, and then your account can get started. So if you are new to the health savings account, you need to fill out this application. Okay? All right, so cafeteria plan. We've been chatting about the cafeteria plan, and some of you might be confused by now, wondering what it is. That is the first form we filled out. You have to return this yes or no, no matter what. So you need to tell me yes or no each year. Fill out the form and return it to me by May 6th. That's a Wednesday. So you have a week and a half, I believe, is what you have to get that form back to me. With the cafeteria plan, there is another option I've put on there. If you're not sure what you're doing, I have a lot of people that go back and forth every year because I think they forget what they're doing. So it's a yes, no, or if you just want to leave it the same, there's a third option I put on there for you this year is I would like to leave it the same. So if you don't know what you're doing and I've confused you thoroughly and you just want to keep it the same, check that box and you'll be fine. Okay. Cafeteria plan, what it does, it allows you to deduct any premiums that you pay. So if you have health insurance, dental, vision, those premiums that you pay, you can take out before taxes are figured on your paycheck. So you get a little tax break. That means usually 25%. So anywhere from 20% or higher, you can save by putting your money into the cafeteria plan. What it allows you to do is pay less taxes. That's the advantage. You get more money in your paycheck. So how it is, if your paycheck is $500 and you have $100 in premiums, you subtract the $100 from $500, you have $400 left. You pay taxes on $400 instead of $500. That's the easiest way to explain it so it makes sense. That's how you save the money. What is the risk? The risk is once you're in for the year. So if you say yes and you're in for the year and then you decide I don't want to pay for that health insurance any longer and you come in to drop it, you can't drop that in premium. You have to keep that insurance until May 31st of next year unless you have a life-changing event. So if you have a baby or adopt a baby, get married, get divorced, death of a spouse or child, termination of employment by you or your spouse, those are all reasons that you can make changes to the cafeteria plan within 30 days. If you don't come in within 30 days, you can't make any changes. It's too late. So 30 days from the date of that event. So if your husband or wife gets a new job and they get great coverage at their job and you want to drop this coverage, within 30 days of that coverage starting, you have to get in here and fill out the paperwork and drop that coverage. Otherwise, it will continue even if you have another insurance. Okay? All right. Nobody can tell you. Nobody can disagree with me. I can just say, no, I'm loving this. All right. Our couple other benefits that we have that we've pushed out is our employee assistance program. Right now, if you're getting stressed, I know some companies are doing layoffs. We're not here, but some companies, you might have a spouse that's in a more precarious situation. Hours may have been cut elsewhere. And if you're feeling stressed, the employee assistance program is there to help. In the PowerPoint, their number is there. Supervisors have access. There should be information at every house. On this, it's an 800 number. You can go online. It is completely confidential. We will never know if you call. They do not send me any information about who called or what happened. So I never know if it gets used. It's just a nice resource if you need some emotional support, some work-life solutions, if you need legal guidance, financial resources, online support. It's all there for you. Call them. They're happy to help. All right, and it's free. That is free to you. Okay? Basic life insurance. The agency provides you with $20,000 of life and accidental death and dismemberment at no charge to you. That is free. There's nothing you have to do. When you were a new employee, you filled out a form. That's still in play. You have $20,000 of coverage. You have the option to pick up voluntary life insurance. Now, this is just if you picked it up as a new employee. If you didn't pick it up as a new employee, you are out of luck. You can't pick it up now. If you have the coverage and you want to increase, you can increase up to $130,000 of coverage. You can add $10,000 every year. So if you have $50,000 right now and you're thinking, gosh, I could use another $10,000, you can fill out the voluntary life insurance form that Shannon's going to show you now. This is the form you need. Fill that out. Increase by 10. So you need to know how much coverage you have. If you can't remember, call one of us. We'll tell you. But you can increase $10,000 a year up to $130,000. Once you hit $130,000, you're pretty much tapped out. That's what you can have here. So, as you know, no insurance has increased premiums this year. Health, dental, vision, they're all staying the same. The only people who will see an increase of any kind is if you have voluntary life insurance and you have had a birthday since June 1 of 2019 that ended in a 0 or a 5, you move up to the next age band, so your rates will increase a little bit. So if that is your situation, your birthday ends in 0 or 5 since June 1st of last year, you're going to get a little increase in your life insurance. Okay? That is true every year. Child age limits. With the life insurance, a lot of people have added kids, and it's only 91 cents a paycheck to add kids for $10,000. If you didn't do it as a new employee, you can't do it now. But if you have that and you have a child who is over 19 or 24 if they're a full-time student, they cannot be covered under the life insurance anymore. So if you are paying for them and they've aged out, they've graduated, they've graduated high school or graduated college, and you're still paying for them, you need to fill out this form and remove them from the coverage. It doesn't happen automatically. I don't know what your kids' ages are or anything. I can't keep track of that. So if you don't take care of it when that happens, you are going to continue to pay, and they do not refund your money. So we've had people that have paid that extra 91 cents a paycheck for 4 or 5 months before somebody realized their kids don't qualify anymore. Take this opportunity, think about how old your kids are, and see if you need to take them off the life insurance plan. Okay? All right. Other coverage that you may have or may want is AFLAC. If you would like to add, drop, or make changes to AFLAC, contact Debbie Hoops. Her phone number's in the PowerPoint that you have available. Give her a call. It's open enrollment time. She's well aware it's open enrollment time. I've already been in contact with her, so she's expecting calls. If you want AFLAC new, if you want to make some changes, drop some coverages, pick up some other coverages, it is supplemental insurance. It pays you directly. It covers costs that insurance doesn't cover. So if you have the accident plan, you know, your insurance covers what it covers on an accident, but they will give you an extra benefit that they just pay to you directly. A check goes to you, doesn't go through the agency. We have nothing to do with claims. What we will do is deduct the premiums. We can deduct them pre-tax if you choose to, but they just go, your claims and everything go directly to Debbie at AFLAC. They're very quick, but they offer things like accident, cancer, short-term disability, things like that we don't offer here. You can contact her if you're interested. All right, scholarship program. For last year, what we did is we had 92 people contribute. Currently we do. Contributions are $235.75 a pay period. Thank you so much for that. It is an awesome, awesome benefit for kids. It gets paid directly to the student. It's for our full-time employees, kids that are are graduating from high school and they're in college. They can apply every year. They're eligible up to age 24, and they're going to school as a full-time student, which means 12 credits. So child has to be attending a secondary education program, post-secondary education, taking 12 credits, and remain that full-time student, and they qualify for this scholarship. Last year we awarded 15 scholarships, $550 each. So we have quite a few kids that could use your help, so your participation is greatly appreciated. and your election just remains the same unless you change it. If you want to make a change, of course, there's a form. Shannon's going to show you the form. That's the form you're going to need to fill out if you want to make a change. If you don't want to change anything, no work to do. We'll be announcing our scholarships shortly for this next year. We're getting ready to award those scholarships. All right, retirement. You can change your election percentage anytime. You need to contribute 5% to receive the full agency match. We put in 1% automatically, and then we match up to 5% of what you put in. This increased last year. We were at 4, and now we match 5. So last year, if you didn't make the change, if you want to do it now, you sure can. You can change that percentage up or down anytime you want. You just need to go online to benefitsforyou.com and create your account if you haven't already. That's the website. Go create your account, and you need to change that percentage online now. If you need help with that, call the Vail Wealth Management. They will help you get your account set up if you're struggling with that. But log in. You can change your percentage on there. It sends me, I get a report every payroll, and I change it from there. So that's what you need to do to change that percentage. Make your account. The website is great. You can play with things, you can look at things and see where if you're on target to retire, when you can retire, how much your account has. Lots of features there. They are really, really good website. Check it out if you haven't already. Okay, what happens now? We buzzed through all this information. What now? Okay, everybody must complete the cafeteria form and return it to me by May 6th. If you have a health savings account, complete the bottom section too. That's what has to happen. Every full-time employee has got to fill out that form, no exceptions. If you want to make changes to other forms, like your health, dental, vision, life, or scholarship, you need to complete that form. Those forms are available by calling myself, calling Shannon Skellis or Judy Miller. We have the forms available. They're at the front desk. We can send them to the house for you. If you want to swing by the admin building, just call Judy. We'll put the forms outside the door for you to pick up. So we kind of got the doors locked. We're trying to control traffic everywhere in the agency. So the other option you have, if you're not understanding all of this and you have some questions, Shannon and I will be at the Family Ed Center on Wednesday, 4/29, and you can come pick them up. That is Wednesday, 4/29. We're going to be there from 9 to 11 in the morning, and then back again from 1 to 3 in the morning. So what you need to do is you need to wait in your car when you get there. We'll wave you in. We're going to only have 2 people in there at a time. We can only talk to 1 person at a time. So you're going to come in. You're going to be wearing your mask. We're going to be wearing our masks. So we're going to keep this safe. You're going to sanitize your hands when you come in, just like always, and then we'll go through the forms, help you fill them out if you need help. If you don't need any help, fill out the cafeteria form, send it back, and you're done. This is not a mandatory meeting. You just need to come if you need help, okay, or call. We can answer some questions over the phone, but we're going to be there Wednesday, 4/29/20, 9 to 11, and 1 to 3, Family Ed, to help. If you have questions, give us a call. Otherwise, that is all the information we have for you this year. Thank you.